So you mentioned a couple things, sort of intervention, prevention, sort of what we can do in order to reduce or to hopefully stop some challenges. So it strikes me as when you sort of identify the problem, oftentimes in kind of a public health model, we go to sort of why does it occur? And usually that's a multifaceted, sort of explanation. And then we think about how might we intervene. And again, that might be multifaceted depending on kind of the why. I guess this may be too simplistic of a question, but you've mentioned a couple things. You mentioned poverty and sort of economic opportunity. I've certainly heard, people talk about intergenerational situations where, the behavior I'm sort of mimicking or someone's mimicking the behavior of their parents, the household they grew up in, bullying on the schoolyard, so forth and so on. I know for every one of these areas, there's probably a myriad of sort of explanations, but are there any, is there any way to sort of, talk about some of the common ones and maybe not, again, how much economic opportunity, sort of within a household or education, or is it really all over the place, if that makes sense?
Well, when it comes to prevention, I think we have to step back and take a global and holistic approach. We also have to understand the pathways to different types of maltreatment warrant different strategies. So say, for example, neglect. Neglect is at high risk in families where there's just not enough resources. It may be economic resources in garnering those resources. It may be social support. It may be loss of a job or single parent households who are struggling. It may be a myriad of things that are coming together in terms of the needs of the parents who are not being met: housing, substance abuse, domestic violence. All of these things sort of come together as a tapestry of risk for neglect. And so in those situations, home visiting paradigms are used as strategies. Basic parent education and parent support are used as strategies, because what we don't want to see is that pattern of neglect transferring from one generation to the next simply because there hasn't been a difference in economic opportunities from one family to the next generation. So that's a different strategy. Physical abuse, on the other hand, I mean, you can sort of imagine that would be different, because those are parenting strategies that may be adopted from one generation to the next because that's the way you were parented. That's the way you were disciplined, and you only know one way how to curtail a child's behavior or teach a child behavioral strategies using physical punishment. So parenting education programs, such as things like Incredible Years or other kinds of parent education that teaches parents different strategies to deal with disciplining their children. So not jumping too quick to harsh parenting and harsh punishment strategies, but how do we think about different ways of parenting kids? So those are the kinds of strategies we would take with physical abuse. Sexual abuse is a completely different animal. Sexual abuse is not really seen empirically as transmitting from one generation to the other in terms of a perpetrator, right, becoming a perpetrator because they were abused necessarily. But we more often see, for example, females who were sexually abused in childhood recreate an environment for their kids where others have access to their kids. Exploitive individuals have access to their kids. So for example, a mother's live-in boyfriend who has had a previous sexual abuse allegations or is otherwise attracted to kids, wants access to her kids. And she has other aspects going on that are sort of sequelae of her own abuse, like substance use, like untreated PTSD, like these sorts of things that preclude her ability to really recognize the danger cues in her own environment, and may not really protect kids from those who want access to her kids. So that strategy is really educating parents about how to create an environment that's safe for kids from those who may want to exploit their kids. That's a completely different strategy. So I hope that we can understand that while prevention needs to be broad and have many facets, that there should be different programs that target different kinds of abuse and different risk factors that will ultimately come together in a comprehensive strategy to reduce the rates of substantiated maltreatment across society.
Mm-hmm. Yeah, no, very, very, very helpful. And of course, the challenge when we talk about comprehensive and multifaceted and the need to kind of tailor prevention and response to particular circumstances, the management and the funding of that is always a challenge. I know in many other healthcare examples, there's a feeling that we in the United States, spend a lot of money on treating acute problems once they manifest, and not nearly enough in prevention. I'm guessing this is no different here, and that we have a lot of resources going to the problems when they happen, probably not even enough then, but probably not nearly enough on the prevention side. Is that true?
Right. So, what you're speaking to there is, how do we really educate policymakers about the benefits of prevention? And we have in our center adopted what we call our research to policy collaborative model. And that is really a model whereby we use the evidence base, we used published empirical research to demonstrate how preventing child maltreatment really would have an economic impact on the public health sequelae of abuse. So we do things like put together models of what it would really cost to enact a universal child maltreatment prevention program, and then put those costs then against what we know to be the health consequences, the health and behavioral consequences of child maltreatment, and show policymakers that balance. Mm-hmm. And in doing so, I think we're able to bring to light and bring to bear sort of the merits of prevention, right? And spending early to save dollars later becomes a very tangible example when we're talking about putting those sort of economic costs to prevention versus what it would be to treat all of the various sequelae of these kids who have gone through this. So mm-hmm. in that sense, we are really focused on translating the research that's out there in the country into these kinds of messages that can really resonate with policymakers at that level, who are trying to make the case that there are certain expenditures that should go to prevention, right? Because we will save money later, but that's a nuanced argument that has to be made using evidence-based policymaking, evidence-driven policymaking. And so our center really takes the body of research across the nation, synthesizes that into policy briefs and one-pagers and what have you, and we provide that as an education tool to congressional staffers and to other people in various levels of governance, so that they can take those to those policymakers who are really champions of prevention, to make it easier for that argument to be made.
Well, that's great work. In our Center for Healthcare Policy, that's something in a strategy that we do in a lot of our work as well. So clearly resonates with me. But in our work, of course, my observation across many different aspects of health is that it's becoming more and more difficult sometimes to take strategies like that and utilize them effectively in the policy community for a whole variety of reasons, many of which, many people are frustrated with sort of the policy environment. So I guess I'm kind of wondering, sort of how much success are you having? Maybe this is an area where there's more collaboration across the aisles, sort of across political mm-hmm. parties, because mm-hmm. we're dealing with kids mm-hmm. and we can rally around that. And that's not mm-hmm. a Democrat or Republican or a liberal or conservative thing. Perhaps that's the case, but what kind of reception and response are you getting? Are the policymakers listening to these strategies?
Right. Very good question. I think, when you start to embark on this sort of research to policy collaboration, you have to pay kind of constant attention to what are the policy levers out there, what's the low-hanging fruit, what are the upcoming legislative initiatives that are going to cross the desks of policymakers in the near future and get involved at that level and become a resource. So we watch policy sort of, say, coming down the federal pike. For example, one huge legislative initiative last year was the reauthorization of the Federal Child Abuse Prevention and Treatment Act, so CAPTA. That was last year. We knew that that was coming up for reauthorization, so we tried to engage those legislators at both the Senate level and at the House level who were going to be on those committees, just to let them know that we're a resource for them, and please come to us when it comes time and you have to make this argument for reauthorization, because it is a bipartisan issue. Child health is a bipartisan issue. It's all of our problem, and to really help them understand that they could be heroes in this policy stage. And indeed, that happened, where they did come to us. Those committees actually came to us to put together the briefings, to put together the economic argument. And we even were invited to do 2 briefings on Capitol Hill. And we had a faculty member at the actual hearing, right? So we were able, that's a big win in terms of knowing what the levers are, knowing who's interested, following the low-hanging fruit and the legislative initiatives that are up and coming, and being a resource to those policymakers, not going to ask for anything, but saying, we want to help, we're here to help, this is what our center does. And those are the kinds of stances I think we should take, and you just have to be constantly watching and constantly ready to help, because as you know, these requests happen rapidly. Policy moves very quickly. Often policymakers don't realize until a week before that they should have some evidence to back things up. So you have to have a group of people ready to respond rapidly. You have to have a team willing to be able to put together and synthesize things very quickly and get things, to staffers in a timely fashion. That's not easy, and it takes resources, and it takes commitment, and it takes a passion for doing so, and it takes wins, kind of like we experienced last year with CAPTA, to sort of reinforce that, yeah, it does work when it runs right.
Mm-hmm.